Peace, AGG Nation. This is AGG, your average gun guy, and we are back with another live episode. And tonight, guys, we have the privilege, the pleasure to have a special guest with us, which is Whiteside Tactical Solutions, actually. So got him on tonight with us. Super excited, looking forward to seeing what they have to share with everybody. So if you have any questions, make sure you drop them down in the comments. But tonight's show is going to be great, guys. So without any further ado, would love for you all to introduce yourselves as well.
Hey, I'm Eric Whiteside, owner or founder of Whiteside Tax Solution, established in 2020, and basically now just coming around and actually starting to roll. We've been going hard for about 8 months, 9 months, so somewhere around there.
Okay.
Hey everybody, my name is Candace Spivey. I'm the educational consultant for Whiteside Tactical Solutions, and we are an emergency preparedness company, and we teach people all the things they need to know just in the event that they ever have an emergency, so they can be the first responders for themselves and for their family.
Okay. Good stuff, guys. Good stuff. So with that being said, let's jump right into it. What does that mean? What is emergency preparedness? I know a lot of people have an idea. You know, what does that really look like from your perspective, being the professionals that you are? What does that mean?
So emergency preparedness just means being prepared for any emergency situation that may come about. It can be anything from trauma all the way to medical, all the way to medical. So I know everybody's familiar with stop the bleed, things of that nature, but we also focus on the medical aspect, as in somebody has a stroke, cardiac arrest, you should know CPR, first aid, how to splint, things of that nature, the simple things. If they're diabetic, how do you take care of that? In addition to that, we also are adding what we call hazmat, so hazardous materials. So being familiar with that. So all around being prepared for, if shit hits the fan or something of that nature. And a lot of the preppers are familiar with that, so we hit on that as well.
Okay. Anything you want to add to that, Candace?
And then, just like basic first aid, teaching people how to use EpiPens, how to use Narcan. Fentanyl is really big right now. So that's something that I feel like everybody needs to be trained on, how to use Narcan and how to use it appropriately. So we just teach people basically the basic ways to be effective in a situation.
Okay. So how long have you guys been training or teaching people on this level? And what would you think is the most important thing that you're teaching right now?
So on this level, collectively for about 8 months, individually about 18 years. In all honesty, worked for me in particular. I started off as an EMT, then I worked my way from EMT to EMT intermediate, but now they call it EMT advanced, and then worked my way up to EMT paramedic. So I have that experience on the street as well as in the military, where I'm a combat medic in the military. So I do a lot of that. But majority of my experience truly comes from the streets, working inner city. I worked in Charlotte, North Carolina, worked in Richmond, Virginia, I worked in New Orleans. So working in those inner city areas is where the true experience comes from.
Okay.
I on the other hand, I don't have the type of experience that Eric has. I am a high school teacher, but I teach AP psychology. So I bring the brain into everything that we teach, so that people can understand not just the importance of learning these skills, but how to get this information out of their long-term memory quickly in the event that they're in a situation such as this. And I've been teaching for 18 years.
Well, that's highly important, Candace. I definitely wouldn't lower what your level of importance. That's definitely important. And you spoke on something that's I think is huge as well, which is the psychological aspect of things. If someone finds themselves in a trauma type of situation, how to deal with that psychologically, I think that's huge and very important, because most people have never really been in a situation where the heart's going to be racing, adrenaline's going to be pumping. So I think what you're saying is huge, very important.
Yeah, we address that in all of our classes, and we tell people that, when you get in a situation like this, the normal reaction is to start with like the screaming and the crying, and we tell them you've got to cut that off, because you're taking time away from being able to save yourself or whoever it is that you're trying to help. You can deal with the emotions later once the person's taken care of, but in that time, right at the immediate time that it's happening, we don't need people screaming and like losing their minds. So we put them through a very rigorous course where there are some people do feel like they're going to, lose it because we want to simulate an actual event so that in the event that they ever have to use the skills that they're being taught, they don't revert to that, which is normal human behavior.
Okay. I like that. So you guys are actually doing simulations and going through actual like dry runs, so to speak, and giving people the opportunity to go through running scenarios. I like that. I love that actually. Where was your last event?
Our last event was actually this past Saturday, December 16th. It was at True Prep, and we trained 22 people on Stop the Bleed. And we set up all of our courses the same. We do a crawl, walk, run is what we call it. So we start out with teaching them the information, asking them questions about the information, allowing them to ask us as many questions as they have. And then we do what we call like the walk part of the phase, where people are able to interact with the material that they've been taught, but in a low stress environment where we're walking around, we're making conversation, we're giving corrections, answering any questions they have. And then we do what we call the run phase, where we throw them into it and they've got to figure out what to do. And that's when we turn the pressure up, and we're yelling and screaming at them, and we want them to feel uncomfortable. We want them sweating. We want them nervous so that they can actually apply these skills in a real world situation.
Got you. So you're giving it to them. I love that. Love it. Anything else you want to add to that?
Oh no, I mean, she hit it all. That's exactly what it is. I always mess it up. The crawl, walk, run phase is the biggest thing. A lot of people just come in and they go in straight to teaching. But like I said, she's a teacher, I'm a teacher. We understand the theory and the thought behind actually presenting the information. So we use that, our knowledge and our experience with that, to present the information to a whole gambit of people to make sure they fully understand and grasp what's going on. Because there's a lot of people who say they're instructors, they go out there and they just present it and nobody really understands what they're saying. And we present it in a matter to make sure that the masses understand. That's our biggest thing. So we always take it slow. In addition to that, we want to build a bridge, because a lot of people come in with prior knowledge. So what we do is something called scaffolding, where they have that knowledge. So we add to that instead of making people feel dumb, like they don't know anything. So they come in with prior knowledge. So we pull that prior knowledge and we just build upon it, because that's how you have people buy in or feel they're part of it, because they have the knowledge. We just want to add to that knowledge.
Enhance it. I like that. That's great. Yeah, I think a lot of people can be intimidated when it comes to the whole like preparedness aspect of things, and most people don't know. And me being one of those people, I definitely won't pretend that I have a clue on what all the aspects of what emergency preparedness, readiness, all that means, or what even the gear that I would need for that. What does one of your classes look like? How long is that? Is it like how long is of an event is?
I let the brain take it away. Go ahead for that one.
Okay, so for our Stop the Bleed class this past week, it was 10 to 2, so normally around 3 hours. But we kind of base our course on the participants we have that are there that kind of show up. So if we've got participants who have a lot of prior knowledge and they're able to kind of respond back to us as we're going through and teaching the information, the basics, we're laying the groundwork. If they've come in with a lot of prior knowledge, we can kind of cut that part down a little bit. But Stop the Bleed is normally 3 to 4 hours. Our CPR course is 4 hours. Our TECC, which is Tactical Emergency Casualty Care course, that's an all-day course when people are trained in Stop the Bleed, CPR, first aid, and carry under fire. So it depends on what course we're doing and on the level that our participants are at.
That's nice. So they can get all of it in one day if they wanted to. I like that.
Yeah.
Like that.
Mm-hmm.
Oh yes, it's intense, but they can get it.
I was gonna say, it may be that. It sounds like it may be a lot to take on in one day, right. But it sounds like it's available.
Yeah, it's there for everybody. Our biggest thing is, like I say, we just had our TECC course at the Pit, which is a beautiful facility. I recommend everybody go out there to utilize it, because Paul from the Pit, he was very open and welcoming. Say, hey, come on out here. This is my place. Do it as you like. And we just had the whole gambit, all 3 areas. We ran all kinds of scenarios, and we love that because we actually poured in the real world stuff, which a lot of people don't do. And there's a lot of, I won't say invalid information, but there's a lot of things people are teaching information that you won't use in the real world. And that's one thing, like run and gun. There's not a lot of run and gun in the real world. In the real world, if shit hits the fan, you're taking care of your family. So how do you take care of your family? How do you bug out to get to those specific locations? Once you get to those locations, you meet up with other people. If they go down, how are you able to take care of them? That firearms, which I love firearms, but firearms is only a part of it, where you have to focus on the medical as well as the trauma, because there's going to be, if like say if there's a shit hit the fan incident, there's going to be older people. They're going to have medications. They're going to do things. They're going to have ailments like that. So how do you take care of them? That's what we want to teach them. One of our YouTube videos, they showed that you had a group go out and a baby went down and needed CPR. So they had to set a perimeter for, they had to set a security perimeter. In addition to that, one man had to start CPR. Those are the things that you're actually going to face. So you have people shooting, but you also have people trying to save lives. That's what we want to incorporate. That's the real world. And that's what we want to actually give people, let them know this is how it's actually going to, is that actually how it is.
That's huge. That's very huge. And that's important. Like you say, a lot of us, we like to dress up and go out and train and shoot. And like you say, run and gun and do all these type of things. But a lot of us would be dead in the water if anything happened to us. So can you walk us through how a basic stop bleed, like how would you stop a bleed if someone was shot in a limb, let's say an arm or a leg? Can you explain to the audience how you would stop that bleed, or what you should have on you at all times if you're in these situations to be able to stop a bleed?
Yeah. Very first thing is we tell people, scene safe. That's your biggest thing. You got, when you get out there, don't just get the tunnel vision, adrenaline run, and just run straight out there. You want to make sure scene is safe first. So if somebody got shot, we know there's a gun in the vicinity. Stop, breathe, take a look around, survey the area, situational awareness, make sure that there's there's nobody else still shooting or anything of that nature. And if they're seen as safe, then you proceed. You get to the person. As you get to the person, you want to don gloves or some type of PPE, whatever you have available. If you don't have anything available, then you try to take care of them the best way you can. One thing is you want to do is pull them into the light, him or her into the light, so you can actually see your adequate light, so you can assess the situation or what's going on with that person. If you know that is a GSW, if there's a GSW, got to identify where that GSW is. Is it in the chest? Is it in the leg? Like you say, if it's in the leg, it's a massive bleeding in the leg. One thing you want to do is pull out that tourniquet and actually go ahead and cinch down the tourniquet. There, when a situation like that comes about, you don't want to waste your time. You want to go ahead and put that tourniquet on, go ahead and stop that bleed, and then from there, if you have to pack the wounds, go ahead and start packing the wounds. But the biggest thing is you want to stop that bleed initially, because they can bleed out in 1 to 3 minutes, sometimes 45 seconds, depending on if that adrenaline is rushing, and depending on where the location of it is. If they get shot in the chest, then you're talking about a whole different situation, because if they're shot in the chest, now you're looking at having a pneumothorax, where our body is normally negative pressure. You have a positive pressure, so that lung's not able to inflate. So you have to put a chest seal on it. So that's a different situation. But in addition to that, we always say what goes in must come out. So if that bullet goes in, where is it coming out of? That's what we need to pay attention to. A lot of people focus on the immediate, but you have to focus on what else actually happened to that person. I know you addressed what should you carry. I tell people you should carry an IFAK, but let's be realistic about this. Everybody say, well, I carry IFAK. In the real world, if you have a book bag, backpack, something of that nature, yes, you can carry an IFAK. But in general, you're not going to carry a big pack with you. You know what I'm saying? The biggest thing is you want to carry a tourniquet, want to have gloves or something of that nature on you, just in case. 2 tourniquets is excellent, but a lot of people may only be able to get 1 tourniquet and carry 1 tourniquet. That's fine. You want to have some type of first aid on you at all times, just in case. It may be you, or it may be an individual or your family member. You want to have some type of tourniquet on you. That way you can stop that massive bleeding.
Okay. What's up, Carbon Q? Carbon Q asks a question. She says, was it surprising to see so many older individuals in your last class?
Nope. We train everybody, regardless of age. We aren't shocked or surprised by anything.
Women included, as I'm sure everyone could tell from our panel up here, women included as well. So men and women are both included.
Yes. Absolutely.
Great to hear. How much does something like that look as far as an investment from a cost perspective? If someone to get that type of training from you all, what are they looking at? How much should they invest in that?
So our Stop the Bleed classes are free. That is our one free class that we do offer. So yeah, even though it's 4 hours, our Stop the Bleed class is free. We do accept donations though, because this is of course all coming out of our pocket. That's how we're funding this business. Our CPR class is $85, and then our TECC course is $275.
Very reasonable. Very reasonable.
Yeah.
Oh, yes. Yes. Well, we try to keep it as cost effective as much as possible. One thing I'm noticing is a lot of people want to be Stop the Bleed instructors, so they get the certification or go on the website, say they're Stop the Bleed instructor. Now it's like just trying to make money. The biggest thing is you're actually educating people and preparing people. So just because you say you're an instructor, if you don't have that knowledge or that experience, why lead them in the wrong direction? That's my biggest thing. Yes, you can go out there and pay $100, $200 for a Stop the Bleed, but what are you getting from it? Yes, you're getting $100, but what are you getting from it? What we notice is there's a lot of instructors that just doing a pool noodle. It's like, okay, that's cool for what we call the dry run. But when it comes to actual simulation, getting our heart rate up, there should be some type of simulated blood coming out where they actually have to stop that bleed or show how they can actually wound pack to stop the bleed. So you know that, or so that person know that they actually gain the knowledge, the correct knowledge. You can do it all day long on something dry. You won't have that great experience. So you must actually get with an instructor that have some type of simulation where the blood is coming out or simulated blood is coming out. So you actually learn how to wound pack correctly or how to apply that tourniquet correctly. So you know you effectively did it. So when you leave, you have a sense of pride and a sense of knowledge.
And again, I think that's huge because you're saying the simulated blood, you're getting to actually see that and feel it. A lot of people go crazy when they see a drop of blood, let alone gushing blood. So being able to at least get that practice, get those reps in, folks out there listening, I think that's huge. And the fact that you do one of those, which is the gun wound treatment for absolutely nothing. Guys, that you got to take advantage of these opportunities when people are in your community or when you have access to people such as Whiteside Tactical Solutions who can provide this for you. But like they said, when opportunities are like this for free, keep in mind that people are regular people. They're giving up their time, energy, resources. These things aren't for free. So donations are very much welcome. And with that being said, Abel 1906, what's up? He said, they say, I don't want to call that a woman or a male. My apologies. But when is the next TECC class?
As of right now, our next TECC class is tentatively scheduled for March the 23rd. That should be a Saturday, March 23rd of 2024. We say tentatively scheduled because there's something else in the work right now. So we say tentatively scheduled. If something else come about, then we'll just move that TECC class into April. Because what we want to do is we have a phase 1 and a phase 2 of our TECC. TECC phase 1 is during the day. TECC phase 2 is at night. So you must complete phase 1 so you can do phase 2. And the reason we say that is because we want to make sure you have that experience and that understanding, you know how to do everything correctly. Plus we're using live ammo. So you are shooting. So as long as you have that trigger discipline, you know how to work that safety, you're good for the day. When we get to the night where you can't see anything except if you have a headlight, a white light or a red light, and you know how to work that safety, we're a little more comfortable with that, then we increase the intensity because again, in the dark it's totally different. And we tell people a lot of stuff happens in the dark compared to the light. And working as a paramedic, I only work night shift because that's when all the crazy people are out. And I love that. And that's why I had a lot of the GSWs, drug overdose, knife stabbings and things of that nature. So I tell people, you can do it during the day. Can you truly do it at night? If you can do it at night and you can do it effectively at night, you're good to go.
Makes sense. Makes a lot of sense. Anything you want to add to that, Candace?
Not particularly. I do want to go back to what Eric was saying about when we do our Stop the Bleed simulation, we actually have actual limbs. And so these limbs that we have, they are very realistic. They look like actual human limbs. We have a couple gunshot wounds which are through and through where you have the bullet going, the entrance and the exit for the bullet. We also have just one regular gunshot wound. This is just the entrance. We have a laceration And the reason why we have different limbs is because we want people to be able to see the different types of injuries they could possibly see. Because normally when people hear stop the bleed, they automatically go straight towards, oh, it's a mass shooting event where people have been shot and I've got to go run in and save all these people. But the chances of that happening in people's lives is like slim to none. People have other life-threatening bleeding injuries, whether it be a car accident or, you know, you're hanging out with your girlfriends and y'all getting a little sloppy and you drop a wine glass and you've now sliced your arm open and you could be dead in 5 minutes. So it's important that we have those limbs there. Like I tell people who come to our class, the reason why we use the limbs is so that, you know, we teach you in this crawl, walk, run phase, because back to the brain, when we learn things, we first have to encode it, like your brain has to process it. You encode the information and then you store it and then you retrieve it. So we go through the crawl, walk, run phase so that people can get to the process where they're retrieving information from their brain without having to think about it. And so that they get that muscle memory where it just happens quickly right off the bat.
Wow, that makes a lot of sense. That makes a lot of sense. You're mentioning things I didn't even consider. I didn't even think of that. Like, you're right. What if you're in a situation that has nothing at all to do with something that's very slim or probably none, slim to none to probability to happen in your life? Like you say, a mass shooting event or something. But what is likely is an accident. You're out somewhere, you bump into a counter, you know, you cut your arm. Like you say, anything could happen to you or your loved ones. And having the knowledge and being able to stop bleeds, that seems like a great, it doesn't seem, it 100% is a 100% skill that everyone needs to have. So I'm definitely going to be at your next event, your next class myself. And I suggest anyone out there that's listening, you be at that class as well. So with that being said, Walt E. asks, he says, what skill level do you need to be to attend a TECC class?
For us, skill level, just if you have general understanding, that's what it is. We literally build people with no skill level and build them up. And one thing we like is if they don't have any experience, that's even better because they don't have those old habits to actually break. So we can mold them into teach them the correct process, and then from there they can cater to how they work themselves. But our biggest thing is you don't have to have any skill level. We take everybody.
Okay.
We take them, you know, from having no skill level all the way up to a doctor, because at our last TECC, we had several doctors out there. So it doesn't bother us.
Wow. Speaking of that, Abel asked as well, he says, I saw you all on the website and it's nice. He says, how were you able to get a doctor on staff? Mentioning that you guys had some doctors out there. He says, when others don't have one.
Well, it was a luck of the draw. My brother is an actual physician, internal medicine. So when it came about, we just put him on board. He was good with that. So we said, hey, let's roll with it. And one thing I like is he has that experience where he can take it up another level just to give people that insight. But at the same time, remind people, hey, you have to work within your scope of practice, which is what we call basic life support or the BLS level.
Okay. Nice. Well, guys, we're going to take a quick, brief intermission so that I could give a shout out to one of my sponsors of the channel, which is Laser Ammo. So guys, I'm heading over to laserammo.com. Use discount code AGG10 to get yourselves 10% off. Great stuff, guys. I'm going to show you a quick little presentation on that, which is some dry fire training, right in line with what we're talking about. Dry firing is right in line with what we're talking about. So let me share this video with you all 1 second here.
Yeah.
So boom, as you see, you can either get the gun that comes with the automatic firing capability like that, or you get what's called the bolt, the flash bolt, and put that into any AR where the bolt carrier group goes. You take that out, slide that right in there, and it has an IR laser on there or an IR on there that allows it to read targets. It's great. You put a little sensor right behind your trigger, and it gives you the ability to also change the poundage of the trigger so you can get your trigger pull exactly how you like it with even with your firearm. So it's really good to use, and I highly recommend it. So go out and check it out. Back to the program.
Yeah, I see there's a tactical say he actually took one, which is actually a good thing. You want to take those, you don't want to pass it up. But and he knows just like everybody else, if you're in the firearms, it's a perishable skill. So I tell people try to refresh every year. You don't have to be every 6 months, every year, jump in on a course, just to make sure you didn't lose anything and just to gain more information. Because when it comes to medical, it changes. When it comes to science in general, it changes. It can be month to month, year to year, but it's never the same thing. And especially with the latest advancements and technology, you want to make sure you stay up to date when it comes to medical, especially with these type of procedures that us as regular civilians can actually do.
Nice, nice. I agree 100%. With that being said, I kind of gotta bring it back to a question I asked earlier, which is, what is the minimum you feel people should have for emergency situations, either on hand, in their vehicle, at home? What is it? I know you said a tourniquet at least, but is it, I mean, what goes inside of the pack that someone should have? Is it just a regular, whatever comes when the pack when you buy it, or are there specific things that you feel should be added to be sufficient?
When it comes to that, everybody's IFAC is going to be totally different. It's based on your situation and your training area, whatever you're going to do. I tell people there are 7 basic things you should have in your IFAC. Light colored gloves should be one of the biggest things that you should have. I know people say, well, I have dark gloves. The biggest thing is when it comes to dark gloves, like black gloves, you can't tell if it's sweat or if it's blood. So you want light color so you can actually identify if it's actually blood or if it's sweat. Especially at nighttime, we know it's slippery, but we can't identify which it is. So having those light gloves, you're able to identify, okay, there's blood. Where's this blood coming from? Chest seals is always a good thing, 2 to 3 chest seals. But when it comes to the chest seals, make sure you pay attention, because you have vented chest seals and you also have non-vented. You want to make sure for the regular civilian, you get the vented chest seals. And the reason is because with the vented chest seals, it allows air to escape. A lot of people in some of our classes had the non-vented chest seals, and they're like, well, I thought these were good. They're good. There's nothing wrong with the non-vented chest seals. However, you need to make sure that the person can actually be burped. And what we mean by that is, just like when the lungs fill up, you have to have some of it escape. And that's where that comes from. The same way we inhale and exhale, you have to have some of that air to escape. So you, when it comes to a non-vented, one corner is actually open or not sealed, so the air can escape. So you have to actually lift it up so air can escape. I tell people that the way to relate this is as if you have real bad gas and you just can't pass gas because everybody's around, and you just feel that painful sensation. But then you go somewhere and you just release it, and as you release it, boom. That's what it is for somebody who's building up that air with a non-vented chest seal. Is having a hard time breathing, but then you open a little corner, let that air escape, it feels better. I know it's kind of sick, but it's something that happened to everybody, to be honest with you. So it's something you can actually relate to. In addition to that, tourniquets, you also want to make sure you have 2 to 3 tourniquets at the minimum. When it comes, especially if you have a kit for tourniquets, like they say, 1 is none, 2 is 1. You want to make sure you have multiple tourniquets. And when it comes to tourniquets, make sure that they're the real tourniquets and not the counterfeit. What we mean by that is, if you take a look at your tourniquet on the back by the plate, it should have serial numbers on it, or it should be some serial numbers embossed somewhere on the actual tourniquet itself. If it's not, then we know that's a counterfeit tourniquet. When ordering tourniquets, I tell people don't get them off of Amazon or something of that nature. Go to a reputable company. You have North American Rescue, you have Rhino Rescue, you have Rescue Essentials, you have all of these. And one of the ones that we're actually sponsored by, TACMed Solutions. So they have a soft T tourniquet, which is an excellent one. So make sure you get one by a reputable company, because you know that is real. That's one of the biggest things. Now, it's okay to order one off Amazon if you want to use it for training. Just make sure you write training on it. But other than that, make sure you have the real ones, because you want those to actually save your life. You don't want it to break when it comes down time to turn it up.
Indeed. That makes a lot of sense. Now you went right into the question which I was going to ask, which is, which one should you get? So thank you for answering that for us.
No problem. Also, Israeli bandage or trauma dressings, make sure you have 1 or 2 of those. I tell people it's similar to that of having an ACE bandage with a 4x4 gauze on it. You want to have that. So in case you don't have to actually use a tourniquet, you can use an Israeli bandage. And people say, well, can I use an Israeli bandage instead of a tourniquet? They're 2 different things. One, we say that is because with an Israeli bandage, you can put it on You can put it on a joint, like a hinge joint, your elbow or something of that nature. You can put it on those because it's elastic. A tourniquet you cannot put on a joint. You also need either NPA or OPA, that's a nasopharyngeal airway, or oropharyngeal airway. Those are good to have, but if you don't know anything about them, don't get them. In our classes, our TECC class, we show people how to use them. That's one of the things. We pull up all our equipment and say, hey, this is how you use the nasal airway. This is how you use the oral airway. Then we tell them the contraindications for using those as well, because people will tell you how to use them, but don't tell you you can't use them for this or that. So you want to be familiar with that as well. And that's where we come with our TECC course to make sure that they're well endowed with understanding what's going on. 2-inch surgical tape, or even duct tape or masking tape, something of that nature. So you have some tape just in case you have to wrap or you have to splint. So you have that as well. And lastly, trauma shears is another one, because if it's a GSW or a break or a fracture, you want to be able to cut away those pants or whatever it is, that shirt, to actually expose the entire wound so you can actually analyze what's going on and treat it properly. And lastly is emergency survival blanket. That can be used as a tent if you got a bug out or something of that nature. But at the same time, if they're losing a lot of blood, you have that to keep them warm. And we tell people, because you have blood loss, you're going to lose your heat. And with that, you need an emergency blanket to keep them warm. Even if it's 95 degree, 110 degree weather, they're going to get cold because of that blood loss. So you must have that emergency blanket or some type of blanket, reflective blanket, to keep them warm. Those are your 7 to 8 basic things in a tourniquet, in an IFAC. And from there, you can build as much as you want.
Nice. Candace, anything you want to add to that, or did he nail it on that?
He did a good job. He hit all the things that are necessary.
This time.
Yeah.
Desert Tactical also mentioned a point that makes a lot of sense, which is he says he didn't really think about how bad applying a TQ would get or getting a wound packed is going to actually hurt. Yeah. So
we want it to hurt. If it's hurting and they're wanting,
do you guys get it pretty tight?
Mm-hmm. Okay. We do. Yeah, we want people to feel how tight it is. And we say if the person you're applying it to is screaming and telling you that you're hurting them and they're uncomfortable, that's what we want, because they're still conscious and they're not dead.
Got you. Okay. What are the I see that when a lot of tourniquets come with pins or a marker. What is the point of that marker? To keep some type of time? What can you explain to the audience the purpose of that?
It's just so that you can write down what time you applied the tourniquet, so that when the EMTs get there, you can tell them. We tell people, once you've applied a tourniquet, you never remove it. You wait until the doctor in the ER does that. Let them handle that. That's all it's for, is just to write the time. If you don't have a marker, just try and kind of keep a general idea of when you applied it. So when the EMTs show up, you can say, I applied this tourniquet to them about 10 minutes ago or whatever, just so that they can relay that information to the emergency medical staff at the hospital.
Good. And another point, should you ever let that tourniquet loose without EMT or without, no. Is there ever a point when you're supposed to let it loose?
No.
Okay.
No.
No matter how bad it's hurting.
People. No. And if it's hurting and they're complaining, that's good, because then they're alive. You'd much rather them complain and their arm is not going to get amputated because you applied a tourniquet too tight. Like it's not a thing.
Okay, got it. Yeah, that was my question. Like, would something like that happen? But you just answered that. It's probably a wives' tale that was just answered. So Thank you.
Yeah.
Thank you.
Yes. When it comes to that one, the biggest thing is your tourniquets now have a thicker band, so it covers a larger surface area. So it's not going to cause that nerve damage that people thought. A lot of people say, well, I can build a tourniquet out of shoestring. That smaller band, or that small, I won't say thickness, the smallest circumference of it, lets them know that, hey, that's going to cause the actual nerve damage, because it's isolated to a specific point, where a tourniquet is thicker, so it covers more. That's why I say you can keep a tourniquet on. There's been documentation, there's been studies out there, actual studies, medical studies with the trauma surgeons by TECC and by Stop the Bleed, that they've been studies where they've had them on for up to 8 hours with no permanent nerve damage. That's the biggest thing. Right. But at the same time, in the urban setting or in the military, there's been cases where I know I haven't been in, but my brother, who's a physician, he's actually been deployed and earned a Brown Star, that he done that, applied the tourniquet, been up, had one of the soldiers with a tourniquet on for 9 hours, then was able to take care of it after that. Had full use of the limbs afterwards as well. So no permanent nerve damage or anything. So that lets us know that those studies are accurate.
Good stuff. Good stuff. Carbon Q asks, since school shootings are sadly a frequent occurrence, do you foresee STB being something that students learn at school?
So in that one, yes, school shootings have become a frequent occurrence, but they're not as frequent as, the media would want people to believe that they are. I know at our school, we recently just trained 52 students in Stop the Bleed. And then there are other pockets of schools that are doing it. I don't think it's ever going to be like a required curriculum type of thing. But students who want to take it will have that option to take it, especially those who are enrolled in like the Health Sciences Academy and things like that. They'll be the students who would be offered the access to take those types of courses first at school, at the high school level anyway. Okay,
good stuff. Good stuff. Anything else that you think is important for people to know about the Stop the Bleeding aspect of things?
I mean, just make sure you get the training. That's going to be the biggest thing. Like say, we're out there, we're giving it for free. So come join us for one of our classes. We just finished up our last one for 2023, but we have multiples coming out for 2024. We're offering, Stop the Bleed as well as other things as well. I know Carbon asked one particular question directly at Candace about training ladies only. So that's the thing that maybe Candace can answer.
Okay. Yes. So in 2024, I will be offering some classes that are for women only. And this is nothing negative towards the men. I love my Black kings. But I do know that in some situations, especially in a situation like something like where you're training people on things like Stop the Bleed, or you're discussing like medical issues and things like that, some women just feel more comfortable in an all women setting versus having males there. Sometimes there can be a male that can be kind of overbearing or can make a woman uncomfortable. So I know that just having like an all women type of medical training, it's important, and it gives women who otherwise wouldn't come and participate just because they're like, oh, there's going to be men there. I don't want to deal with, the possibility of being hit on or, whatever. So they wouldn't show. So we want to provide that as an option for the ladies in 2024 as well.
That's great. That's great. That's great. What date in March was that next event, that next big event?
TECC is tentatively scheduled for March 23rd, 2024 at the Pit.
March 23, March 24. Got it. Okay. And shout out to Paul from the Pit.
Yeah, we love Paul from the Pit.
Indeed, indeed. Good brother. All right. So good stuff, guys. Make sure you go out there and take advantage of that. Like you say, that's something that everybody needs to be involved with and get. As far as other training that's important for people to have at home for emergency preparedness, what are some other things that are important aside from stopping the bleed that are important out there?
Well, definitely CPR and first aid. In 2024, we're also bringing a babysitting course for anyone ages 11 to 18, just because it could be even for just staying at home with younger siblings. There's some things that I think we think is just common basic sense knowledge. And just in talking with like our students and things like that, it's like, okay, that's not common knowledge. All right. So there are just some things that we want to clear up, but we want to make sure that if anyone's watching a younger sibling or is babysitting, that they're prepared for all different eventualities, so they can provide the best care possible. And they can charge a little bit more because they can say, I'm a certified babysitter, so I'm certified in, all these things.
That's great stuff. That's good stuff. So you're hitting all aspects of the community, the family, the individual male, female, children. Everybody gets individual attention. So there's nobody that you're not touching out here in the community. That's amazing.
That's the objective, because we've learned as teachers that, like she said before, there's a lot of our students that are taking care of their younger siblings, but they're also taking care of their older family as well, like the grandmother, grandfather, something of that nature, and they have medical problems. And one thing we like to do is make sure it's not just Dr. Bleeds, not just first aid CPR, that we teach other medical aspects as well. One student was talking about they had a family member or their grandmother was diabetic, and she went to diabetic crisis where the sugar level actually dropped. And it was just in one of my classes that one of my school classes I was teaching my students, we were just going over diabetic emergencies. I was explaining what was going on and what could happen. And just having that knowledge, that student was able to say, okay, her sugar level dropped, went to get the glucometer to check the sugar, notes that her sugar level was in the 30s. And then from there was able to treat it. And that's what I love, where they have this knowledge, they can actually take care of it. Granted, she called 911 as well, but at the same time, they knew what to do. And that's what we want to do. We want to put all this medical information out there. We're not the gatekeepers. And that's one thing we tell people, we're not the gatekeepers. We'd love for people to ask questions. Ask questions. If your instructor cannot ask questions, that instructor may want to figure out what's going on. They must be able to answer questions. And there's some questions we know that you may tend to forget. Always find an answer for that question. Don't just lie to the person. Just make sure you have a valid answer for that person.
Great stuff. And how bad would you feel as an individual if somebody, lost their life on your watch? And it was some basic skill set that you could have had, like just knowing how to do the CPR the proper way. Because I truly don't. It's been quite some time since I've had my CPR training. Like you say, just because you get it, you have to keep that going. You got to keep recertifying yourselves in these aspects. I think that's very, very important, because just because you've done it once doesn't mean it's with you forever, unless you're practicing it continuously.
Right. And you say you're not certified. Hey, come on back. Come on us. Come on.
Indeed, I'm going to come to you. I'm coming to your next event for sure. I'll definitely be there. I'll definitely be at that TECC event for sure. Abel asked this. Or Abel says, why do a lot of places only teach STB but don't offer, but does not also offer first aid and CPR, as victims may lose a post despite the tourniquet being on?
Well, we can't really speak for other places, but we do offer first aid and CPR. It's just that's a long day if you do stop the bleed, first aid, and CPR all together in one. And that's why we tie that in with TECC. But we do cover that as a portion of our Stop the Bleed course. What do you do if you've applied a tourniquet, if you pack the wound and the person has lost consciousness and then stops breathing? How do you handle that? And so we do kind of go through, just give them a little taste of CPR, which is hands only CPR. And we explain why it's hands only and why people are no longer doing mouth to mouth. If it's a family member, you absolutely can do the mouth to mouth, but if not, it's not necessary for getting the person's heart restarted.
That's good information. That's good to know, because of course you see TV. The first thing you see on TV is them plugging the nose and open up the mouth, and so that's what you see. Good stuff. Carbon Q also says, will treating burns be included in the FA class, or is that a separate class?
No, that's actually included as well. We cover treating burns and the different types of burns. You have your first degree, second degree, and third degree burns. But in addition to that, break it down. We cover both hypothermic and hypothermic. So basically, if they're dealing with heat emergencies or cold weather emergencies, we cover all of that, because you never know what you're going to face. Being in this area, or in the southern states, we're more likely not going to have the hypothermia. We might go to cold weather emergencies, but we're more likely going to have the heat emergencies. So we want to make sure we cover everything, because who's telling that this person living in the southern state doesn't move to Colorado? They move to Colorado, now they have to worry about cold weather emergencies. So how do you treat these? So we cover all of that. First aid, we cover all of that. We cover a little bit of CPR. We also cover a little bit of stop the bleed, wound packing, tourniquet use, cover splinting, how to splint and what to use for splint. We use a lot of SAM splints and things of that nature, so they understand how to do it, how to form those SAM splints around the different deformities. We also cover triangular bandages, how to apply a triangular bandage. So we cover a whole gamut of stuff. Our first aid class, we try to cover it, combine it with CPR, but our first aid class alone is about 4 hours, 4.5 hours. Then you have your CPR class. So a total of 8 hours for all of that. But we cover a lot of it. And in addition to that, we're actually moving to tactical med. Because again, there's a lot of active shooters going out there. So we have to tie that in as well. So we're tying that into our first aid CPR.
Great. Man, you guys are covering all areas. Y'all are covering all areas. I love hearing this. I love seeing this. This is great stuff. And the fact that you guys are local here in the Atlanta area, anything that I could do to support you guys in events, anything you just need extra bodies, let me know. I'd be more than willing to help out. And also, Abel says you offer a lot, like I just said. And he says, do you have a location in Atlanta, or are you located somewhere else too, or at least travel for a large group of classes or do you at least travel for large group classes?
For the right amount of money, we travel anywhere in the world. Right. But seriously, we do feel like the skills that we're teaching are skills that, everybody absolutely needs to have. So we do travel. It just depends on how far we're having to travel in terms of like what the cost is going to be. But we do tailor our courses for the group in terms of what that group wants and where they're located. So we're open to that. We have provided classes all throughout the state of Georgia. So we do that as well. And then we'll shoot up to North Carolina, South Carolina.
Yep. We did open up a new location. We have our second location in Las Vegas out there with my brother. So we have two hard locations, one in Georgia and one in Las Vegas. One thing is, because we know SHOT Show is going to be out there, so it's a little convenient to hold classes out there as well. So he has his area. He actually traveled to SHOT Show, get some information there, but also train in that area. So we do have two locations. So you can say we cover both the East Coast and the West Coast. Got
the West Coast and the East Coast on lock, man. I love it. Great stuff. Great stuff. And soon you have the Middle America as well. That's the next. All right, guys, we have reached a part of the show that I call the rapid fire session. This is where I ask you guys a question, and you guys tell me the first thing that comes to mind. And I'll allow both of you guys to answer as well. So when I ask the question, ladies first. So Candace, you'll go ahead and answer first, and then you'll follow up, brother. All right, let's do it. All right, first gun owned.
Oh, an S&W 380.
Oh, me? Well, my bad.
Yeah, you get
yeah, my bad. I have two Glocks. Two Glocks, so those are the first two I own because I bought them at the same time.
Okay. Red dot or iron sights?
Red dot.
Both. You can know the iron, you can do a red.
Striker fire or hammer fired?
I'm not gonna pretend like I know the difference between them, so I don't know.
Striker.
Okay. AK or AR?
Oh. AK.
AR.
Okay.
You just want to be different from me tonight. Is that what we're doing?
That's what we're doing.
It's different. It's different. Last gun purchased?
The S&W 380.
Okay.
I lost all mine in a boating accident. I don't know what you're talking about.
All of them are lost. They're all gone. The bottom of a lake somewhere.
That's right.
He has like 15.
If you guys could be any superhero, who would it be?
If I could be any superhero, who would it be? Mm-hmm. Oh, I'm gonna be the Black Panther. Yeah. Even though that's a male, I feel like I could pull off that suit.
You can pull it off. You can do anything you want to do in this world.
That's right.
Oh, that's a good question.
I took your answer, so you can't change it.
I know, right? I was gonna say Black Panther, but I guess Superman.
Okay.
Yeah, Superman, yeah.
Glock or Canic?
Glock.
Canic. Okay, so I have Glocks, but I love Canics. So that's gonna be my next purchase. It would be a Canic.
I'm the same way. I ride with you on that one, brother. I have Glocks, but I love Canics. Delta Force or Navy SEALs?
Delta Force.
Navy SEALs.
Okay. Indoor range or outdoor range?
Indoor.
Outdoor.
Okay.
Ball from the pit. The pit.
If you guys could have any wish, what would it be?
Oh, for teachers to be paid what they're actually worth, and that's my wish.
That is
I ride with you on that.
Yes. Yep. If we paid what we're actually worth, it'd be nice.
It's a dream.
That's it, guys. You guys went through. You made it through the rapid fire unscathed, untouched. Didn't have to use those skills that you guys are talking about tonight. We made it. So, guys, I know the next event is coming up in March. How can people out here reach you and get a hold of you so that they can be a part of the next event?
Yes, please, please, please go and visit our website at whitesidetacticalsolutions.com. Also, please follow us on Instagram at Whiteside Tac and on YouTube. January 1st, we will have our new schedule posted for January through March, our new calendar for January through March. And you'll be able to go to our website and you'll see our calendar and you'll be able to register for those courses right there. And we would love to see everybody attend at least one course.
Absolutely, absolutely. Any final words you would like to leave with our audience?
Yes, one thing. You want to put that myth to rest, Spivey?
Say one more time.
Yeah. There's a myth. So I have to clear this up. Okay. So in our Stop the Bleed class on Saturday, and then in previous Stop the Bleed classes, we've had lots of people say things like, for stopping the bleed, they don't have any gauze and they don't have a t-shirt and the person who's injured doesn't have a t-shirt. So can they use a tampon? I want everybody to hear me clearly. The answer to that is absolutely not. Tampons do not stop anything. Tampons are for absorbency, okay? They absorb, but they don't stop the flow of blood. And I get it. You know, you men, y'all luckily don't have this issue. And so that's why everybody's always like, oh, a tampon or a pad. Yet no.
It seems like it would work.
It seems like it will work, but ask any lady. Well, let me rephrase that. Ask any woman that you are comfortable with, and that would be okay with you asking her this question. And she's going to tell you, no, the tampon does not do what you think it does. It doesn't even stop the bleeding for what it doesn't even do what it's supposed to do in general without other assistance. So we're just not going to use tampons or belts as tourniquets. And that's just the one little myth that's out there that I want to clear up. But tampons are not effective for stopping the bleed. And you can put 10 of them in there and the person is still going to be bleeding and you're going to have done nothing but put a bunch of tampons in the
and cause more trauma.
Yeah.
Causing more problems than doing any good.
Yep.
Yeah.
That's good stuff. That's good stuff. I'm sure there's people out there at home have heard these wives' tales.
Yeah.
And you put them to bed. You put them to bed. That's what this is all about, bringing good information to the people. So, hey, we love it. Well, that's all I got for you guys. I won't hold you too long. I know that we're all out here and again on the East Coast here in Atlanta, Georgia. It is almost winding up to be 10 p.m. out here. So I thank you both for joining me tonight. Thank you so much. You've brought our audience so much great information. Make sure you guys head on over to whitesidetactical.com. That's how you can get more information about our great guests tonight and about their upcoming events and get registered for those events. I suggest you get registered ASAP. Don't wait till the last minute. Go ahead and get registered right away. Get registered now so it's on your calendar. We got a new year coming, guys. Start getting your game plan together right now, what you want your new year to look like. And this is a great way to get it started.
Oh, yeah. Thank you for having us. Definitely.
Yes, sir.
Thank you.
Yes, sir. And yes, ma'am. You guys are welcome back anytime. Thank you so much for being on the AGG show. So, guys, with that being said, everybody out there, stay safe, stay trained, and stay free. Thank you guys so much.
Good night.